The next measurement which is helpful is the neck circumference. So the patient has to be sitting upright and you measure the neck circumference at the superior border of the cricothyroid membrane. Asking for the collar size is not acceptable. Women with a neck circumference of greater than 40 centimeter and men greater than 43 centimeters are at risk of having obstructive sleep apnea. If they have a neck circumference of greater than 48 centimeters, it's a very high probability they have obstructive sleep apnea. Then we look at the various facial features or characters which might cause narrowing of the upper airways and lead to obstructive sleep apnea or increase the upper airway resistance. So the facial characters which can lead to this are the reduced oropharyngeal, which lead to the reduced oropharyngeal space, are deficient mandible. So it could be a retrognathia or a micrognathia. The picture at the top shows that the patient has got retrognathia. You can see that there is a receding chin, and the second picture at the bottom has got micrognathia. This lady does not have a chin at all. The tongue, because it does not have a normal sized tongue, does not have enough space because of the smaller size or the retrospaced mandible. It is pushed posteriorly and superiorly, which narrows down the oropharynx. The hyoid bone, again, which lies behind the mandible, is pushed downwards below the mandibular line, which also leads to some variations in how the muscles are attached to it, and again can lead to narrowing of the oropharyngeal space. The other facial characters we look for is reduced cricomentalis space. So this is the distance you measure from the cricoid at the midline to the mentum, which is the lower part or the most prominent part in the middle of the mandible. The shorter the distance, the patient has got retrognathia. The other thing we also measure is the increased overjet. So overjet is the distance between the tip of the incisor from the upper jaw and of the incisor of the lower jaw. You can see it on the picture on the right bottom. There is a big gap between the teeth of the upper jaw and the lower jaw, and that is what we call the overjet. And when the mandible is not large enough, you can see that the teeth also get crowded. Maxillary deficiency again can lead to higher arch palate and also lead to narrowing of the oropharynx and the nasopharynx.